he said, haven't you ever heard of CBP? I said, no, what's that? So I looked it up. And I remember the criticism from medicine and science back in the day when I was in school was always, okay, you say the spine is out of place, as compared to what? And to us it was, well, the one above and below. But that totally negates the fact that, you know, this, and we call it this, the misalignment is called a subluxation. This is a massive subluxation. You know, this is a massive subluxation. And you might not have much that's out of place with any of its other because it's so uniform. But it's still crazy. And what they found in the medical research was that when you do that, you're pulling on the brain and you're pulling on the spinal cord. And guess what happens? Take a guess. What happens to the spinal cord when you pull on it like that? It actually dies. You get massive die-off of spinal cord cells. And talk about a gigantic stress fire in the brain and the body. That's it. Yeah, the guy's name was Alf Breed. And he looked at, you know, the body loves to be, you know, moved like this. But if you chronically put it over here or you're losing your posture, you get that brain death and spinal cord death. So anyway, this guy named Don Harrison, he said, you know what? He was a math teacher in high school, and he became a chiropractor. And he'd always, you know, had a gift for math. And he said, you know, and he looked at the medical books, and medicine had a normal value for everything. Your head, your eyes, your vision, your smell, your lung capacity, ribs, hands, legs, everything had a normal value. What was, this is good, and anything that deviates from that is bad. They didn't have one for the spine. And so he said, you know, I could do that. I could figure that out. I think that, you know, it would have to be a mathematical engineering formula. And he said, but, you know, damn, I'd have to go back to school and become a mathematics PhD. But he cared enough to go back to school and do it. So he got his math PhD in the late 70s and started with this thing. And he rounded up all of his buddies, and they started taking x-rays. They took the x-rays from their patients. And they just assumed that if you had pain, your spine was abnormal. And if you didn't have pain and health problems, your spine was normal. And so they just set up all of these and started screening people and looking at the shape of the spine. So he came up with this, you know, obvious thing. The spine is supposed to be straight this way, but, you know, if we turn it in the side, you're supposed to have part of a circle here, part of an egg shape here, and part of an egg shape down here. Ellipse, curve. And so, you know, they looked at the incidence of arthritis and things like that, so he wrote it up as a mathematical formula and presented it to, just went to the head of the class, Spine Journal, the flagship journal for all the neurological and orthopedic associations in the world, and they accepted it. And when they got the paper, they were so excited, and they said, "But man, we've got to check this out." So they sent it to 2 Yale mathematics PhDs, and they said that this is brilliant work. This is your answer. This is how the spine should be. And so, you know, there's so much specialized knowledge in the world that even if that's your field, a lot of people miss it because there's just so much information. I remember reading back in the 1840s, that was the last time that they had a gentleman who was an expert in physics, engineering, and mathematics. I can't remember his name. He was a brilliant designer. 1840. That's the last time a person could learn enough of the information in all of those disciplines to be a specialist in all of them. And so, you know, as more information comes out, you know, it's like this fan of more and more information. So if you're over here in chiropractic, or you're over here in orthopedics, or you're a neurosurgeon or something like that, this information's coming out. And this guy mapped out the spine, and still not everybody knows about it. And when they incorporate the CBP knowledge about the spine, when they reconstruct your spine surgically, if they put you in place in those Harrison curves, you do not get degeneration and you do not have symptomatology, other than the fact that that joint or however many joints are frozen in place, and that's never quite a good thing. But it completely changes everything. So and so Harrison, he said, look, I mean, they're right. We don't have any research. And so, the CBP people, they've put together about 300 papers on all sorts of things to make, chiropractic bulletproof. And, some people are impressed, but a lot of people don't know about it yet. And, there are some people who, their commercial interests, we conflict with theirs because the healthier you are, the fewer drugs and diagnostics and stuff you need. So in any event, every time I go to the CBP Annual, they've always just got some terrific stuff. I mean, mind-bending stuff. This was not one of their papers, but this Brain First Healthcare poster I've got was not their work, but you can see the brain before and the brain after. Germs and viruses are not the cause of our problems. In fact, they're necessary for health at every level. Any individual has 7 trillion germs and viruses in their body at any given time. And if you didn't have them, you would die literally within hours. They're in a symbiotic relationship with us. And the healthier we are, the more they're like exercise. The healthier you are, if you exercise helps you get healthier. The same thing with germs and viruses. Doesn't matter what they are. I tell people, what's the deadliest thing on the planet? Deadliest thing on the planet?
People.
Anthrax. And so if they dropped an anthrax bomb on DC, what percentage of people would die? 42%. Rabies is another awful, awful, scary disease. So if you got attacked by a rabid wolf pack or a rabid, pack of raccoons or dogs, what are your chances of even getting rabies?
20%.
20%. Exactly right. So, and who do they get? Who do the diseases get?
The vulnerable.
They get the unhealthy. So the healthier you are, the more your body kicks the snot out of anything. So, in chiropractors, we believe that, we've got another gear here. Everybody knows about, diet and weight loss and some exercise, and those are your 3 speeds. And weight management was added in the 1940s, when they had all of these corpulent white dudes from the Victorian era, and they said, geez, these guys are dying like flies. That's a bad idea. So those are your 3 speeds, and chiropractors say, well, weight management, I mean, really, that comes from diet. So, it's really not 3, that's still 2. So, we say that, the body's like a musical instrument and it needs to be tuned, and that's another gear in health. So, and I could go into the history of that. But in any event, at the CBP Annual, and then, let's see, 2 years ago, they did this one, the blood flow to the brain, where they had you lie on the Denny roll for 7 minutes, and you had this much blood flow going to the brain before using the Denny roll for 7 minutes, and remember, you're supposed to use it for 20. And then after you've been on the Denny roll for 7 minutes, you get a surge of 200 to 400% blood flow to the brain. And 3 surveys of the medical literature say that the number 1 reason for dementia and Alzheimer's is reduced blood flow to the brain. And so if germs and viruses aren't the cause of our problems, in fact they help us, unless if you're really unhealthy and then they start to recycle you for your constituent parts. Stress, psychological, chemical, physical, this is the cause of our problems. And the brain, its hardest job is moving us through space and keeping us aligned. So just going on those orders of complexity, if stress is causing a wounding of brain performance, the first and biggest thing it's going to negatively affect is the most complicated function, which is moving us through space and holding our structure. So that's why it's a universal norm that as we go through life and we get more and more nicked up by stress, our feet fold in, we lose our feet posture, and we lose our spinal posture, right? And the spinal cord starts dying, the brain starts dying, right? We get reduced blood flow to the brain, and we get all of this plaquing in the brain, and it's just awful, and it's hard for people to move, and we're off to the races. So, that was fantastic, and that was 2 years ago, and I couldn't wait to get the poster on my wall of that pre and post brain scan and the blood flow to the brain. So this year, two cool things came out, and was it last year or the year before? The CerviGuard. The CerviGuard came out because it is really hard to correct a misshaped spine. The easiest thing to fix is this. But spinal neck curves are hard to fix. We have the iTrack robotic traction there, which works great. But what's Alex is wearing, do you want to take it off, by the way?
Yeah.
So poor guy, I'm surprised
You're the
he's still
winner.
standing.
Yeah,
Talk about a guy who's going to need a glass of wine after he gets out of this. So anyway, so 2 years ago, they came out with the CerviGuard here. And they had a whole bunch of research with it and pre and post x-rays. And even if you had a really messed up spine, if I looked at that spine, any chiropractor, any CBP chiropractor looked at that spine, he'd say, oh, that's too messed up. It ain't coming around. And this will get results, really good results. So this year, one of the best papers was with the CerviGuard. And he had a woman, I can't remember, maybe she was a social worker, and I think she was taking a whole bunch of fentanyl every day, and she could not see patients. And her life was a mess, her life was hopeless, and so she went in to see Dr. Ron up in New Jersey, and he did the CerviGuard, and he showed the CerviGuard, and unfortunately I was looking for the email, they send a case a month. And I don't know what I did with it. But in any event, here's the upshot.
Bye, Kevin.
Thanks, Kevin. And so the woman had a terrible scoliosis. I mean, it looked like a lightning bolt, okay? I mean, literally like this. And it had so much arthritis that there's absolutely nothing you can do for that. It's too much. It's too arthritic. And her neck was equally messed up. So in any event, he put the CerviGuard collar on her and greatly improved her neck curve. Did nothing for this down here. She's completely out of pain. She's not taking any medication, and she's back at work, happily. So that is a revelation on how important this is. I mean, the whole spine is important, is every huge case like that as responsive to improvement in the neck? We'll have to find out. I was just telling Alex that the #1 issue in world healthcare is a condition called HRP, high resource patients. And these people eat up all your medical funds, and it doesn't matter if you have socialized medicine or you have privatized medicine. It's all getting eaten up, mostly getting eaten up by this condition, and it consumes 15 times your resources of cancer and diabetes combined. And the #1 issue is misalignment, arthritis of the body, chronic pain in the body from arthritis, which is 96%, according to congressional testimony, 96% of arthritis is caused by two little joints being out of place. So the more CBP, chiropractic, and this idea of the alignment of the body, and the body is like a musical instrument and it needs to be perfectly aligned, the more that sort of comes into the fore and becomes a part of our daily lives, we're going to be healthier and healthier, and we're going to need fewer and fewer drugs, fewer and fewer diagnostics, and fewer procedures and surgeries, et cetera, et cetera. You just don't need them. That's why young people, they don't buy insurance, because they don't need it, because they're healthy. So that was a great one, and then the other one was a study we're teaming up with a group of people in Saudi Arabia who are very interested in chiropractic and posture and nervous system. And so we've got this long-standing relationship with these people, and they're doing great work with CBP. So the other one was a study on forward head posture, like this, and it was published in Nature online. But like that is a key scientific journal. So Nature picked it up and published it online, so highly prestigious. And they looked at, I think it was like 150 people, with forward head posture, and they put them on the Denny roll. And they did some very, very sophisticated testing on them. And so what they found was, if people had pain and forward head posture, if you corrected their head posture, their brain became 20% more forceful, more coordinated. And if they didn't have pain, then the increase was between 15 and 10%. So as you lose your forward head posture like this, your brain becomes retarded in its function and its coordination, its aptitude by 20%. So you go out and meet the cause of diseases and any condition in your life, stresses, psychological, chemical, physical, and immediately your brain is 20% less able to handle your life than if you were properly aligned. So, I mean, what's that not going to affect? So I'll wrap it up there. Anybody, have here, freshen your wine. Any questions or any topics you want to discuss or anything?
I feel like I need that.
I know I'm
the
thorough.
thing I need.
I know I'm thorough, but
I'm scared. Danny roll, 20 minutes?
I know I didn't give you all the answers.
I feel like I need more Danny roll time. Yeah.
Yeah.
Well, how about from your own experience? Can you pinpoint some cases that reinforce what you learned at these symposiums?
Yeah. So, as a rule of thumb, in the old days, when you went to chiropractic school, we had an old axiom. Chiropractic cures 80%, 10% won't change, and 10% get worse. And I found that was very, very doggone true for, the decades I was in practice. And then when I found out about CBP, I learned a very important factor is to realize that when people are misaligned and they're very bad off and they're way stressed in their life, and then when you start to misalign, when your body starts going malfunctional in your own body, that's called an endogenous stress. And endogenous stresses, science says, are 10 times more damaging than outside stresses. You're a bad boss, working too many hours, eating too many Doritos. Yes, those are stresses, but once your body starts, hanging up inside, that stress is super toxic. That's 10 times worse. That's an endogenous stress, an inside stress versus an exogenous stress outside. But they all start with exogenous stresses. So when you have somebody who's really messed up and old and fragile, and they've just got this lifetime of wicked stresses, you have to meet them where they are, and you have to be very, very gentle and get into it and sort of introduce yourself and let the body get used to what you're doing, because what you're doing is really effective. It's really going to change them, and if you change them too much, you will make them sore and give them a bad experience, and they'll think you're a quack. So that was very important. And then the other thing, Michael, was running into CBP and saying, okay, so this person comes into me and they say, Doc, I've got digestive issues. Doc, I've got, psychic issues. I can't, I saw a person get killed, years ago, and I can't get on an airplane. And I'm wondering if chiropractic will help me. So I get them on my table and I adjust them, and they get up off the table. And they get this response here. So I've de-stressed their brain, but they're still shaped like this. Thanks, Doc. I'll see you later. So now we know with the CBP that, okay, we did some real good for them, but we left this here. And this is a misalignment, this is a subluxation. And chiropractors used to rationalize that and say, oh, the body can deal with that. But it can't. This is still a subluxation. Alf Brieg and medical research all said, no, that thing is going to age. Whenever you have a kink in the spine like this, a subluxation, in 1921 an MD found, by looking at 50 cadavers, and he found that those areas, wherever you have a kink, it ages 2 to 3 times faster than normal. And then he said, what happens is, that's like, I'm just paraphrasing, he says, that's like the tip of the pizza slice. And then the pizza slice goes out here, and he said, all of this ages 2 to 3 times faster than normal. So you're at age 50, and this is age 85. Right? You're age 70, and this is age 105. He said it happened 50 out of 50 times, and he said, we always found the cause of death inside that pie slice. His name was Winslow, and he published his study at the University of Pennsylvania in 1921. It went in the Medical Times, which at that time was the preeminent medical journal of the day. And he had become fascinated with chiropractic because of its performance in the 1918 flu pandemic, when the chiropractors were called in for all of these infectious disease cases, and chiropractors knew what was going to happen. They'd do the adjustment, and you get this de-stressing event. They didn't know exactly what was going on, but the chiropractors in Iowa and Illinois were called in for 1,300 flu cases. And of those, only 3 passed away. And in Oklahoma, and chiropractic was not organized enough to do, big surveys with quality. And also, chiropractors felt they had a quality control. So not everybody's a good chiropractor, and we don't want their results messing up our results. So they just did Iowa and Illinois, and they only did Palmer School graduates. Oklahoma did a study, and they had chiropractors, they were called in on 300 cases where they said, ain't gonna come back, no hope, just give them the last rites now, they've got this flu and they ain't coming back. And of those 300 cases, only 30 died. So, how did I get into all of that? Anyway, so when you introduce the CBP stuff, what I found was when I had a patient like this, Michael, and they didn't get results, well, then I knew that I had to get them over here and use the CBP mirror imaging techniques to make them go over this way as best they could, because the chiropractic wasn't done with just the adjustment. The chiropractic ended when we got them as close to this as possible. Or if they were here and they didn't respond, okay, we worked on their posture. Sometimes they weren't interested in improving their posture or getting x-rays, right? Just do what you can for me, and that'll be good. And then, so they don't do it, or then they have some sort of a health issue later on, and I say, okay, it's time to x-ray them, and we start working on this. And like as not, the results were commensurate with not leaving that massive postural problem in place.
What about scoliosis?
It's it's there's a scoli brace. It used to be, it was pretty much helpless, useless. There was nothing we could do, but now there's a thing called the scoli brace, and it's very effective. I'm halfway certified in that. I just don't see that many patients, and I don't see that many scoliosis patients, so I haven't finished certification. I want to get one myself, and also scoliosis is a very interesting thing because now that you can improve scoliosis, a big deal is scoliosis in people over 60, because we know that the telltale sign is the spine starts twisting. And when it starts twisting at a rapid movement like that over the course of 2 or 3 years, we know next it's going to start bending sideways like that. And so that's why we have a lot of our relatives that were, very well postured in their early days, and then something happened, and rapidly they started going downhill, and they wind up like this or like that. And so that's a developmental scoliosis in old age that's not actual real scoliosis in a child.
But my my sister had scoliosis, and it was like a lump in her back.
Yeah.
Yes.
Yeah,
And she said it was because of poor posture. I said, well, I don't know.
it could have been. It could have been. If it's real scoliosis, it's a genetic thing where the spine starts twisting in youth. But this is a geriatric thing where it starts misaligning in our 50s, 60s, 70s.
Yeah. Hers started in her 50s, I think, but sure, by the time she passed, it was
Yeah.
serious.
Any other questions?
You mentioned chiropractic.
More wine? More wine? Anybody? Yeah, but you don't have to wait on Alex to get
Oh,
more
wait,
wine.
Alex, that's.
Because this is good. Because if you don't drink it, I'm taking this home. Yeah,
I was
Alex.
just curious, you mentioned chiropractors in 1918. I didn't realize they'd been around that long. How old is chiropractic?
Chiropractic was discovered in 1895 by a gentleman who was then a magnetic healer. There's lots of people that have a lot of what we would call chi in their touch, and there's Touch for Health, which is practiced by, I think, 24,000 nurses or something like this. And people meditate and develop their touch, and it works. How effective it is, don't know, but it has a researched, bona fide, positive effect. It's like an amplification of the human touch and how valuable that is. So bone manipulation has been practiced, throughout the ages, because what did people do when they used to subluxate their knee or knock their shoulder out of place? So in various instances, it's been practiced all over the place. And one in Yugoslavia looked very much like chiropractic. The difference with chiropractic was, and osteopathy was a manipulative art, and they adjusted everything in the body because they were trying to liberate bad blood. And so the misaligned joints impeded the bad blood, and osteopathy was very easily accepted because medicine at the time operated on a theory of bad blood. So chiropractic came along, osteopathy came along around just after the Civil War, and an MD lost his entire family. His name was Andrew Taylor Still. Lost his entire family to diphtheria or something. His wife and his 5 kids all gone in 3 months, and he said medicine isn't worth a damn. But he used to be a migrainer, and he would hang his head in the rope swing when he was a little kid, and his thundering migraines would reduce, and he said it's blood flow. And so he started manipulating the joints, and he had great results and became a sensation. So D.D. Palmer in 1895 said, this guy had been a deaf janitor, and he heaved a heavy crate down in the basement, and when he heaved the heavy crate, there was a misalignment in the middle of his back, right here, and as soon as that thing went out of place, he was stone deaf. For 17 years, he had learned how to read lips, and he and Dr. Palmer loved a bad joke, a corny joke. The cornier, the better. So he said, Dr. Palmer, I told you that corny joke the other day. You smacked me on the back, and I swear to God, it improved my hearing a little bit. And he said, lay on the table and let me check it out. So he checked it out, and he found this gigantic knot out in the guy's mid-back, and he crunched it in place, and the guy's hearing immediately came back. And 2 treatments later, his hearing completely restored. And so Palmer said, the genius of Palmer was that he said, no, this is neurological, that's spinal cord, that's brain, that's what this is about. So osteopathy was doing more for more, manipulating every joint in the body, and your treatment would take an hour to an hour and a half, and Palmer was, no, less is more. Find that primary subluxation, crunch it into place, and you liberate the brain and the nervous system and their information. So I'll wrap up with just a little interesting sidebar. Half the people coming into chiropractic at the time were osteopaths. And they said, chiropractic cures like lightning. I've never seen anything like it. And a lot of women, too, which were not barely allowed in medicine at the time. So, 1895. And incredible results in the 1918 flu pandemic. Yeah. Anybody, any other thoughts or any other questions?
Any current studies with post-COVID patients or
I can
anything
only
that's
hope.
coming out?
I can only hope. You know, I thought, you know, going into COVID, I longed for something like an infectious disease sensation that chiropractic could be affirmed yet again. But you notice with this one, you know, when you went into the hospital, they didn't let anybody in to come in and try and help. So you had to get people at home, and I don't know. We'll see what people put together. Yeah.
So I want to know about the atlas. What you always talk about. Like, what's the significance of that?
Yeah.
And the manipulation.
So in the 1930s, B.J. Palmer, the son of the man who discovered chiropractic, D.D. Palmer, in 1895, he had somebody present to him an idea that the atlas was really important. So the atlas is this ring on which the skull, the top of the spinal cord, and the brain sit. And so he started experimenting with that and getting extraordinary results. It's one of chiropractic's most powerful techniques. And so for over 20 years, that's all Palmer taught. Instead of full spine adjusting, it was just atlas and axis. And it's incredible, you know, the results that we get. There was a guy that I found out about, Dick Holtz in Chicago. And Dick Holtz was doing all sorts of research, and all he did was, you know, atlas adjusting. And one of his studies was with a guy named Becker or Breckman, but in any event, I think like 10 years ago, it got international attention. They did 2 atlas adjustments, and they got as much blood pressure reduction as a person being on 4 or 5 blood pressure medications from 1 or 2 atlas adjustments. Got international attention, and turns out that I think it was maybe 2008. But in any event, the co-author on this study with Dick Holtz is the #1 blood pressure guy in the world. So it's not nothing fly by night about that. Legend has it, or urban legend has it, that when the medical guy saw the results from his statistician, he looked at it and he said, "Let's run those figures again." And the guy said, "I already did." So next, Dick Holtz was assembling and looking for an equally prestigious co-author, because he was doing research on atlas adjusting and cancer. And he told me and a buddy of mine just before he died that his best case was a guy that had, I think it was pancreatic cancer, and the guy had a tumor the size larger than a grapefruit. And he had given him 1 adjustment, and I think 6 weeks later he did, you know, the full PSA and all the blood works and everything like that, and the MRI, and the thing was the size of a walnut. So atlas adjusting is way cool, way powerful, but it doesn't cure everything. And you know, if you've got this wicked atlas subluxation, we get that straightened out, and we still have this, you know, this is not going away. You know, it may get rid of all of your pain, but this is still degenerating 2 to 3 times faster than normal, and it's still having a pie slice that's degenerating 2 to 3 times faster than normal. Last little thing that I will say, and then you guys can go, or you can ask another question. I'm happy to do whatever. But the good Lord has provided me just bumping into stuff, just reading stuff. There have been now 3 studies, maybe 4. I have to look at my manuscript. But one study was a mathematical calculation on DNA and cell life. And that study said that human lifespan was 140 to 150 years. And then it's lights out. The timer's up. You ain't gonna live anymore. And then I think 2 years ago a study came out, and these statisticians said, they looked at the oldest people in the world, and they said human lifespan is 115 years. So that's just looking at how long people live. That's not looking at human potential, but they're still trying to address that. Now, I think it's 3 studies now have looked at either, one was a team of biologists, and the other one was a team of geneticists, and the other one, the most recent one, which was in the last year, I don't know who it was, what their specialty was. Anyway, these 3 teams all looked at DNA, and they all found the exact same thing. A human lifespan is 140 to 150 years. Now, at least 2 of those studies, I don't know if it was in the most recent one, but the other 2 by the biologists and the geneticists, they said, we don't understand why we're only getting 2/3 of the way. And I had a eureka moment, and I said, I know! Them people are twisted up! And as Winslow said in 1921, this is aging 2 to 3 times faster than normal. So this is going to be the anchor that drags you underwater and drowns you. And, they've been fighting us since 1895. They don't want to let us in. So, nobody knows about, how important that musical instrument is to have it perfectly tuned, because if it's off even a millimeter, whatever's downstream is going to age 2 to 3 times faster than normal, as Winslow said, as we described in autopsies, and that is top flight research. When you open up a creature and look at it, you can't get any more evidence than that. That was 1921, and so what they're finding out today corroborates exactly with what he said 100 years ago.
You remember, I had chronic Lyme disease,
Yes.
and the remaining thing after I had alternative practitioner was I had these cicadas in my brain,
Right.
and it wouldn't stop. It was
Yes.
there day and night, and I was going crazy.
Yes.
And I came to you,
Yep.
and you did my,
Did you do the atlas?
the atlas. I don't know how many times, several times, but it went away. I said, there's something to this.
Yeah. There was a funny story by a guy. He was wanting to find a career for himself in healthcare, and he heard about this famous doctor, Dr. Pettibon. No, not Pettibon. And so he went and saw him, Toughness. Went to his office, and he was sitting in the, I'll finish up and then you can go. He was sitting in the office, and the waiting room was full of people, and he just started talking to them about, what Dr. Toughness had helped with. And everybody in there was talking about something different that he had done. And so he said, the guy is either a crank, these people are crazy, or this is the greatest healer the world has ever seen. Because when you talk about brain and nervous system, the master system of the body, probably anything is going to respond. So, anyway. Well, any other questions? Alex, you want to take off?
Yeah, I gotta go.
Yes, absolutely. Thanks for staying.
Bye.
I feel like I'm gonna die next week.
Oh, we just need to cinch you up.
Yeah.
We just need to cinch you up. That's all we need to do. Oh, the other cool thing, Alex.
Yeah.
The other cool thing is that I was talking with Ron, the inventor of the ServiGuard. He already has underway a DOD study at Walter Reed using the ServiGuard on totally messed up troops that are so messed up and debilitated that they're going to quit the service.
Yeah.
And the service has so much money invested in their training that anything they can have to pull them back is worth it. And they're going to find that with this. The only other thing I'll say, funny story, was I was watching this thing on ESPN, and it was on the Chicago Bears. The 1986 Bears, this tremendous football team, and they were interviewing all the players, the key players, including their quarterback. And I'm looking at Jim McMahon, their quarterback, who is famous for, teeing off into people like a linebacker, right?
Yeah.
And I saw a thing on senility and brain damage in NFL players like 10 years ago, and Jim McMahon was sitting there with his wife, and he was incapacitated. I mean, he was practically drooling on himself. So I'm watching this ESPN show, and there's nothing wrong with Jim McMahon in the world. And so I'm saying, what's going on here? Did they tape this before Jim McMahon started to get addled? or what's going on. So in the body of the show, they say, yeah, these doctors contacted me, Jim McMahon says, and they said, we can help you. And so he says, I go to them and they take all these x-rays and they showed the two doctors and they were looking at x-rays and MRIs. And you know, if it was Jim McMahon's neck, instead of having a curve like this, it was like that. So you're totally messed up. So he said, yeah, these doctors, and they showed Jim McMahon on the side, you know, getting his atlas tapped, and I said, what? He said, yeah, these doctors, and he said, and when they tapped me, didn't say neck, didn't say atlas, you know, didn't say chiropractic, didn't say anything. He said, 5 minutes later, it was like my whole brain opened up and life was gushing up into my brain. And the doctors were saying, yes, when you have this impediment, it totally blocks everything that the brain is supposed to get and everything that the brain is supposed to send. So Jim McMahon totally addled, you know, 12 years ago, they do atlas work without even addressing his cervical curve. They're still getting astonishing results. So that Walter Reed study is going to be very, very special, and we're hoping to take that to the NHL and the NFL.
That's great.
But they didn't mention chiropractic once in that whole thing, that whole show. Why not? Anyway.
You guys ever win?
Yeah, thank you.
Well, it's interesting
Thank you.
because the VA is doing a thing with Boston University, the CRT, and all these brains are being donated from families of injured service members who have TBIs,
Yeah.
along with NFL players as well.
Yes.
So we're researching their brains.
When you say we, are you
The
a part
VA.
of that? The VA is. Can we, you know, hook up, you know, and, you know, on this Walter Reed thing and,
Well, I mean, I can line you up with people that are running.
okay, cool.
Yeah.
Because I told Ron, I said, I'm in Washington, you know, I know some people that, you know, handle that kind of thing, and I'd like to help.
Well, I know the people that run that program. So.
Cool, all right, okay, cool,
That's why my back is messed up, because of the Marines.
right,
Yeah.
right. But, you know, we just need to cinch you up. A little wine, a little cinching up.
Be nice and loose.
Yeah.
Is that on video?
No, he's off video.
More wine for him.
I'm the only person I know. Only the doctor is seen drinking in this video. Thank you, sir.
Yeah.
Thank you.
You gotta do a good pour watch, babe.
Oh, yeah,
Oh,
show her how to do it.
holy
Gee whiz, and that was somebody else's wine that she was being cheap with.
I was being respectful for others.
Oh,
Thank you.
okay.
I
That's
think I
right.
had a rough day.
Yeah.
Nope. That's right.
Well, guys, I mean, thank you so much for coming.
Yeah, thanks for sharing.
Yeah,
That's interesting.
yeah. Always good stuff comes out, right? Start
How
talking.
often do we need to visit you for these results?
So that is a very interesting thing too. A guy, what was his name? Perot, Ron Perot, P-E-R-O-T. He had 27 published papers on epigenetics and genetics. World's foremost, one of the top people in the world on epigenetics, i.e. how your environment is changing your genes. So Perot was a migrainer, had terrible migraines, and then he bumped into chiropractic and his migraines got cured. And he said, I have looked at the impact of everything on the face of the earth and its impact on genetics, the genes, and nothing really makes that much difference. You know, good diet does, you know, the classics, right? Some weight loss and things like that, okay? So, but he said, one thing makes a difference, and that was a cat's claw enzyme. That really helps genetic repair. And I used to carry it in here. He said that was the only thing that really made a distinct difference. So anyway, he looked at chiropractic. And it was another one of those epiphanic moments when the statistician comes running into his office, and some chiropractors were there to help him, you know, with the chiropractic stuff. So a buddy of mine was in there when the statistician comes literally running in. Dr. Perot gives him the paperwork, and Perot looks at the impact of chiropractic on human genetics, and he says to the chiropractors, hang on, you guys wait here, I gotta go. So he went with them, And so he found that chiropractic, the influence of chiropractic, not even CBP, had no glass ceiling in the beneficial impact on human epigenetics. In other words, the more you did it, and the longer you did it for, i.e. numbers of years, the better and better the impact was on your genetics and on your health. So I would think that if we did a study, we would find that people who, the more often they got adjusted, the better off they were. But the thing is, if this is still there, then this is still killing you 2 to 3 times faster than normal. So you're doing the chiropractic thing and you're eating right and all of those things are good. So those things I like to say are saving you at 20 miles per hour, but this is killing you at 90 miles per hour. So who's going to win? Yeah, it'll have a beneficial impact, but even people that are on, you know, even if they got adjusted every day, if they're still here, they're not going to get to 140 to 150 years. That's my take on it. So, Michael, how often should we get adjusted? I mean, pocketbook, patience, how often do you want to get adjusted? It's not going to do you wrong.
But you're here 2 days a week.
I'm here 2 days a week. That's enough for you.
Denny roll.
And your Denny roll. Your Denny roll. We gotta, you've got to use your Denny roll. And if your Denny roll is not getting the job done, then we need to kick up to the Cerviguard collar, because you can do that at home. Your home chiropractor. It doesn't do what an adjustment does to clean the brain, but it does something that the adjustment can't do, which is actually realign you.
Why can't chiropractors do something about chronic diseases like I have, electrolyte imbalance?
We might be able to, hon, but I don't know, it might be age, it might be other stresses.
No, it's a few stresses. But my family, my uncle died with it, and I have a first cousin who's like 5 years older than I,
Right.
who has it. So I know it's curable. I just know it is.
Right.
I'm trying different things, but I'm not sure they're working because I still have to take the medication.
Right.
It's-
And also, as we speak, I mean, that, you're talking to me and, you're here. Like
I am?
Yeah, this has to be fixed. I mean, you're so much better than you were when you came here, right? But you're not here.
Like that.
Now you're there.
That's a little extreme.
Stand
I
proud.
know.
That's what I found, is that I have to constantly remind myself to
You
stand
do.
up straight and suck all this up, and it makes me an inch taller.
Well, gravity never stops working and pulling you where you don't want to go. And so we just have to work. I mean, nonstop vigilance. But it's like riding a bicycle. If you start in the best time would be to educate people and start them in childhood so that, they stay upright and we monitor their spines. And after every significant trauma, psychological, physical, chemical, we monitor their spines and keep them there. It's so much easier to do that, to ride the bicycle that way, than to ignore this whole factor because they've been standing in our way, standing between us and the good people. And we get to here, and then we start. It's just not the same.
How could I research that?
Go on the CBP website.
See?
The CBP website.
It's Ideal
Chiropractic
Spine.
BioPhysics.
It's idealspine.com.
Idealspine.com. We'll give it to you. All right. Everybody ready to go? Everybody good?
Thank you.
Questions? No? Okay, good.
Ready for some wine and more wine and cheese? We have more wine if you'd like it, and much cheese too, and crackers and stuff.
Cool. Well, thanks you guys for coming.
Thanks for inviting me.
Yes, thank
Yeah,
you.
thank you.
Sorry, thank you.
Thank you.
Maybe we'll do it again in 4 weeks or 6
Yeah,
weeks.
excellent.
Good time. Some good wine, some talk.
I don't think so. I was asking Brooke, because the patients that she sees, a lot of these kids, I mean, they're,
Kids?
They're neurological. I can show you pictures. The amount of scoliosis is next level.
Really?
yeah, it's bad. beyond anything I've ever seen in my life.
Right.
As you're talking, I'm thinking about these children are suffering and they're wheelchair bound.
Well, they're fusing them and rotting them because it's literally impacting organs at a young age.
So, I've got to turn you on to the scoliosis brace stuff and the scoliosis stuff, because at some point in time, these congenital scolioses
Yeah.
start.
Yeah.
And what if we were tracking those people and these little kids and, putting them in a scoliosis brace
Yeah.
early to stop that? The difference between a scoliosis brace and the classic Boston brace,
Yeah.
the Boston brace locks you in place and you can't move.
Yeah.
The scoliosis brace puts you in a mirror image situation opposite of your scoliosis
Yeah.
and gives you freedom of movement so that you still have natural physiological pumping processes that keep that joint healthy and stop it from degenerating. So it's a total sea change from the old Boston brace.
Yeah, it's true. It's like tone and spasticity are probably some of the main causes, plus the neurogenic spine. But yeah, you should be talking to physical medicine or rehabilitation doctors, because they're the ones that they're making those calls and then they're sending them on to neurosurgeons. But yeah.
So did you find the adjustments more effective after both the doctor and the patient had had a glass of wine?
Yes.
Yes,
Especially
I dated a chiropractor before.
You did?
Yeah.
Well, that's why it's so.
Actually, Michael Singer is angling for an adjustment right now.
And we would drink wine and she would adjust me.
That is so low. That is
That's all
so
on camera.
low.
It's all on camera.
Oh, sorry. She would
Michael,
adjust
I'm
me.
happy to adjust you.
adjustment.
So Jose,
Yeah.
tell us, you dated a chiropractor
Yeah.
That's
and?
why he's fearful of you.
Yeah.
Oh, really?
She would adjust me.
She did some jujitsu and
I
stuff.
have no
No, when we
idea.
were drunk, she would adjust me.
This is the
Scare
first
shit
time
out
I
of me.
hear this.
Oh man, that wasn't chiropractic, that was jujitsu.
What's up?
That was something else, not that either.
It started as
That's what he said.
Yeah, it started as chiropractic and ended up as a headlock, a chokehold.
Something.
No
Yeah,
problem.
yeah, I know. See, no, that went beyond therapy, Jose. Way beyond therapy.
Yeah.
I think that's a good opening scene for your next novel.
Absolutely,
Yeah.
absolutely. Do you want an adjustment?
Open up the cheese, open it up.
Absolutely.